Hey everyone, it's Dr. Shirlea North from North Star Physical Therapy, and welcome to the new year. I know some of the previous podcasts were just really talking about some self-reflection and coming into the new year, what are our goals, either professionally, personally, for our own health. And so we're going to get into some specific topics for today. The recording of this will come out in February. And so the big holiday hoop to do in February is Valentine's Day. So I'm just wanting to reach out to pretty much everybody, whether you're going to be a Galentine, right? You're going to be independent on Valentine's Day or with your partner or partners on Valentine's Day. But we want to really help normalize the conversation around intimacy and intercourse and sex, because those are all very different things. And in particular, as a pelvic floor physical therapist, I often see people that have pain with penetrative acts like intercourse, whether vaginally or rectal insertion, whether it's with self, with partner or partner. So I want to just help normalize this conversation when we talk about sex, when we talk about pain with sex. What does that all mean? All right. So we want to kind of dive deep, no pun intended, with this topic. So when you have sex, the sex is a very broad term. Okay. So sex can be oral, manual, penetrative. It can be with different anatomy, as well. So, or with toys or with self. So we really want to help figure out really what is it about that activity that causes pain. So my role as a pelvic floor physical therapist is to get down to the why, and if it is really something that's within my scope of practice, but more times than not, it's definitely a big factor. I know we've talked a lot in the past, and we'll continue with other podcasts about how the nervous system plays a huge role when it comes to pelvic floor function and tension and, your stress levels and all that stuff. So that is for a different podcast altogether. And this is like I'm just talking about the biomechanical piece of how the muscles, ligaments, joints, tendons, the fascia, all of that within the pelvic floor area needs to be able to be bussable for the penetrative act, as well as strong, yes, but it needs to be definitely flexible and pliable and mobility. And that can depend on what we're using, how we're using it, and in what position. So that's when I'm asking questions to get a little more in detail about the pain with sex, if that's what you are coming into my office for. I do ask a lot of follow-up questions. I do ask permission to ask these questions, as I feel ongoing consent within this area is very much needed and a priority. But we want to make sure we're getting down to the why. Is it really of how the toy or how the device is being used? Is it the angle of entry? Is it the position that the participant that's receiving, right, as being penetrated? Is that what's painful? Or is it really the reverse? Is it the partner that's the penetrator, right, that is penetrating? That's who's having pain, right? So that's where I often ask, is it self? Is it with one partner, 2, 3 partners? For me, there's no judgment here in North Star Physical Therapy. Okay, so I treat within every pelvis, right? So men, women within the LGBTQ plus community, with self-pleasure, with one partner, with many partners, doesn't matter to me. We want to get down to why you're coming into my office, right? Like, why are you having this symptom? So know that there will be follow-up questions. When you are saying, I have pain with sex, describe the pain. You want to make sure we're making good descriptive words. Is it throbbing? Is it dull, achy? Is it radiating anywhere? Is it sharp and stabby? Is it pins and needles, right? So get down some of those descriptive words, because that would really help guide the clinical exam. Is it upon immediate penetration? Is it upon with depth? What position are you in where you feel that discomfort? What position are your legs? Are your hips? Are your pelvis? Is your top halves? What's going on? Was there any lubricant used? Was there any toy? Was there any foreplay before? You see how I'm just listing out like 20 questions and just right there, but do you see how by us getting down to the details, it helps us give better recommendations as pelvic floor physical therapists, and then it also really helps with guide our treatment, guide our objective measure. Objectively, what am I expecting? But that may surprise me, right? But like, what is my hypothesis that I'm trying to develop as a clinician? And then when we do have the permission to hands-on and objectively find any soft tissue tightness, any joint restriction, anything like that, it's like, okay, that's confirming my hypothesis, or it's really bring me down a different road and we need to figure out the whys for that. So that's when someone comes in with a diagnosis of dyspareunia. Okay, so dyspareunia means pain with penetration. And oftentimes it is vaginal penile, but also have that for those that are using dilators and vibrators. It's also with anal sex. So it isn't always a heterosexual issue. It is also within a same-sex couple, is with multiple couples. So please know that like bodies are bodies. Okay. And we hold stressors different. We have different anatomies, different bone structures, different muscle tension. We all need to be able to work together, right? It kind of takes two to tango. But if you're doing self-pleasure and you're having that pain, that's, your hand or the vibrator or the dilator or, whatever the case may be, and you are the two, right? So I just want to help make this conversation as comfortable as possible for the client to know there are going to be follow-up questions. There are going to be questions that we need to help qualify and quantify like what is going on, so that way we can develop a clinical hypothesis and seeing what lifestyle potential modifiers we could incorporate, so that way objectively when we're able to have that permission to be hands-on with the physical exam, that can help again make our hypothesis true or change it. We're all little scientists and problem solvers, so we want to help, but we need to know what the why is. If, I don't know how many times I have had a couple come in and it's really just one partner who is their receiving end, and they penetrated partner, and they're the ones having pain. And so we go through all those questions and all these things, and they are told, I don't know how many times, oh, my provider just told me just to use lube or just have a glass of wine and relax, and that's what's going to solve my pain. You know how disgusting that is to just be told that? Like, yeah, go get drunk and just lube up like a slip and slide and you'll be fine. You won't have any pain. That is the biggest load of shit. Okay, so that is not how we do things, and that is not being respectful of yourself and your body, and shame on that provider. Here at North Star Physical Therapy, whether it be in person with somebody or even talking through it, even virtual consultations with folks, ask those follow-up questions. You really see kind of what's going on, coming down to the why behind things of, is it a potential old low back injury that never really got truly rehabbed or resolved, and we have pain with sex? Is it a, after birth and it's your first time having sex again and you're just not sure, or having intercourse with your partner, you're just a little insensitive and you tense up, and that's the why, right? Is it where you're partnering with, it was a quickie, right? And there wasn't any time for any kind of foreplay and using lubrication appropriately, and it was like a stingy burnie. Is it maybe upon exam, we have some, like, for example, for those that identify as women that have labia, and maybe one labia might be a little bit larger than the other, and that soft tissue kind of snuck in when being vaginally penetrated. There's so many different examples, and so we want to make sure we are really understanding what sex means, to the person. So make sure you're coming in with qualifying, like, describe the pain. How long does it last for? Does it ever go away? Is there any relief? Is there anything that makes it worse? And then also be able to describe the activity. What does sex mean to you? Because for everybody, it means very different things. And is it intercourse? Is it vaginal? Is it anal? Is it with a dildo, diameter, a toy? Is there any foreplay before? So all of these things, again, we're just asking these questions to help qualify the answer, because sex should be, an intercourse should be an enjoyable experience. We do not want to be designated with dyspareunia, right? We want it to have an enjoyable experience with yourself and with the partners for that, and whether or not that means for, conception or just pleasure, and that doesn't matter. But what's interesting is a lot of times I have couples that are from their conservative backgrounds that were never really taught sex and intercourse and what really happens, and just assumed that one position in particular was the only way that you can do it. And so as a pelvic floor physical therapist, my role is not saying you have to do missionary. You have to do missionary. That's the only thing you can do. No. My role is for the understanding of the pelvic position of both you and, if you have intercourse with a partner, to respect the pelvic angle, to respect the hip angles, to respect the angle of entry as well. So oftentimes when I'm talking to, for example, a woman, wife, and male husband, that it is the wife that's coming in because they're having that dyspareunia upon, penetration. And really we're finding out it's because the husband maybe had a back injury and it's hard for him to get into the right position. So she's trying to adapt to his stuff. And really, we all need to work together. So oftentimes I do ask the spouse to come in the next session, or for us to meet virtually so we can talk. And I have my little models and demos and everything, so that way I can help demonstrate that angle and the kind of the biomechanical things around that, and to understand, do you see how much bend that you have to do and how much extension you have to do, and when we adjust one pelvis, we need to adjust the other. Maybe consider another position, right? And so when we are on our back versus sitting versus on our side versus all fours, all these things, right, we can incorporate, and just to kind of get a little bit better understanding. I don't want to be super clinical where you kind of feel a little robotic and the emotion is out of it. But once we're able to understand the why, then the fun can really happen. It's okay, we know that this position works well for us and this one does too. Let's maybe try this. And so that's what makes it fun. And that's where to have that communication between the partners as well as self, to know okay, self, I know I start to tense up if I only have 10 minutes for self-pleasure, versus if the kids are asleep and we're going to be good for a little bit. So there's a lot of factors that come into that dyspareunia and that pain with penetration. Oftentimes too, dyspareunia is coupled with other penetrative things. For example, for those with natal vaginas, when every month there's a menstruation, right? When you're in your menstrual years. And so we had to be able to, for those that utilize tampons, menstrual discs, menstrual cups, you had to be able to insert and remove that menstrual device. And so that insertion, that penetration can also have discomfort. That's not normal and that's not common, okay? So that shouldn't be happening. If you're having pain with inserting a tampon or inserting a menstrual device, you need to see a pelvic floor physical therapist. If you're having pain with inserting for any kind of pleasurable intercourse or sexual act, you need to see a pelvic floor physical therapist. If you are having discomfort with any pelvic exams, right? So we have to get pap smears and check out the vaginal tissue. If you're having any kind of penetration there and it is painful, that is not okay. You go see a pelvic floor physical therapist. For those that are being penetrated anally, and so for men, for example, if you're having your prostate checked and having rectal exam, yes, it's not the most comfortable. There's going to be pressure, but there should not be pain, okay? And so some of that is also the provider kind of prepping you this is how it's going to feel. This is what we're going to be doing. Are you okay with that? And getting you into a good position. But if you go through that experience and you have pain either during the exam or after, you definitely need to see a pelvic floor physical therapist. If you are having sex anally and it is the penetrator is having discomfort and pain, you need to see a pelvic floor physical therapist, right? So There are so many examples just right there where pelvic floor physical therapy can help with this pain and pump penetration. And I want to make sure that we are normalizing the conversation, that we are saying this is for any and all genders and sexual orientations, that wherever there is an access point, vaginally, anally, right, or any kind of like toys are being used manually, orally, penile, again, toy, there are also things that we can utilize within a pelvic floor physical therapist as treatment. So if someone already has a dilator or vibrator, we can maybe utilize that to help solve the problem. We also have other things like, for example, different products like the O-Nut, which is awesome, where you can use that on the penetrator. For example, if there's a penis or a dildo or a vibrator, you can utilize these concentric silicone rings to help with the depth, control the depth of penetration. So that way the person is being penetrated can really help control and relax and to be within that moment. So that way they don't feel so out of control and just having to quote unquote deal with the pain and penetration, that they can be really participating. And that way they can be able to give the green light, oh, okay, we can take off our ring if we go a little bit further in, things like that. So it is a topic that often isn't discussed that much, but please know that within the states, of Virginia and actually throughout the United States, physical therapists have what's called direct access. So this is something that if you're having this discomfort, please don't think that you have to go like straight to your primary care provider, and you can come straight into a pelvic floor physical therapist office. And we may need to, yes, consult with the medical team that we find, there are things that need to be worked on with that. But please know that if you have this symptom, that you, number one, you aren't alone. And number two, there are resources. There are pelvic floor physical therapists. So for anybody out there, and do have virtual consults. So let me help you. Feel free to connect with me and look on my website, or feel free to click the link here in the show notes too, that I can help guide you that way, even virtually, so that way until you find an in-person pelvic floor physical therapist that can help you with this. Let me help guide you, in your journey here, but please know that you're not alone. This is a serious topic to talk about with your providers, and especially with a pelvic floor physical therapist to be within your village, because this is exactly the perfect symptom and topic that we have such a good grasp on, and that we can treat so well and so much faster than taking medication upon medication and having the emotional toll. You're not feeling good enough because you can't tolerate sex. So please know we're out here. Pelvic floor physical therapists are for you, and here at North Star Physical Therapy, I'm here for you too. So feel free to reach out if you have any questions or want to connect virtually. And again, until next time, see you in the next podcast.